Hi, I'm Amitha Balachandra. We're bringing you this conversation because the IMD has now spoken about a fresh spell of heat wave. In fact, on Sunday, Delhi's temperature was as high as 49 degrees Celsius in Gurugram, and other parts of NCR, it was as high as 48 degrees Celsius in Gurugram. It was the highest since May 1966, and there's been a continuous spell of heat wave like conditions since March. March was the warmest, and April was the fourth warmest in 122 years. Now, the Indian Meteorological Department declares a heat wave over the plains if the maximum temperature is 40 degrees Celsius or higher and 4.5 degrees above normal, with this criterion being satisfied over 2 consecutive days. There is orange alert that's now been issued in several parts of the country like Punjab, Haryana, Uttar Pradesh, Madhya Pradesh, and Delhi. There's a yellow alert in Rajasthan. So we're going to talk about what precautions we should be taking, what are the do's and don'ts, what don'ts, what we should be wearing, and what we shouldn't be. To have all of those questions answered, I have Dr. Sanjeev Bagai, Chairman and MD of Nephron Clinics, joining us right now. Dr. Bagai, thank you so much for joining us. First of all, if you can tell us, simply explain to us what heat wave means and what are the different stages of heat wave.
Yeah, so good day to everyone. So I think this is something which is unforeseen to be experiencing this kind of temperatures in northern part of India, mainly in Delhi NCR. At least in my living memory, having lived here for many decades, we've not experienced such kind of heat toxicity. So when you talk in terms of heat wave, it is medically and scientifically defined as 5 consecutive days of a temperature which is 5 degrees, which is 5 degrees Celsius or 9 degrees Fahrenheit more than what the average at that time of the year is. And there are norms which are available as charts to define region wise. Say for example, in India we classify it at slightly higher degree. In US it is 32.5 as a base at this time of the year, and surprisingly in Sweden, which is a Scandinavian country, we have a norm at 25 degrees. So different parts of the world geographically run different norms as a base. So anything which is more than that as 5 degrees Celsius or 9 degrees Fahrenheit in 5 consecutive days is considered as a heat wave. So I think we need extreme caution, and we need actually, as a health emergency, a public campaign to let people know what it is to experience this kind of intense heat.
If you can also tell us, this has gone on since March. In fact, March was the warmest, April was the fourth warmest in 122 years. What are the common complaints you've been hearing from patients, which can directly be linked to heat wave?
Right. So when you are exposing yourself to this kind of intense heat, there are a lot of variable factors which very often people tend to overlook, and it's out of sight, out of mind. One is age of the person who's being exposed. So obviously, the smaller children and infants are more predisposed because they run different ratios of body surface area of age and weight versus adults. The second are the elderlies, and third are the immunocompromised or people who have chronic organ disease. The second is duration of exposure, direct exposure, indirect exposure, and if you are on any medication internally. So the body goes through different phases. So a body is naturally inherently learning to adapt climatically to these kind of changes. So an Indian subcontinent person would tolerate this kind of heat slightly better as compared to European or Scandinavian or Russian part of the world. But having said that, you go through a stage of what we call as heat exposure, then you come to heat exhaustion, then you come to what we call as heat stroke, and then of course is what we call as a very catastrophic emergency called as shock. So I think the smaller infants, the elderly is beyond the age of 65, immunocompromised, and people who are on medication, especially people who are on chronic organ disease, who are on diuretics, blood thinners, patients who are chronic kidney disease, chronic liver disease, post transplant. These are the patients who become more vulnerable to this kind of exposure.
And what are the symptoms, if you can tell us? We'll get to the severe aspect of it, which is heat stroke, like you mentioned, in a bit. But if you can first of all take us through heat exposure and heat exhaustion, what are the symptoms?
Yeah, so initially a person would feel just headache, intense headache, severe headaches, sweating, profuse sweating, decreased urine output, leg cramps, abdominal cramps, vomiting, skin rashes, skin burns, eye burning, what we call as eye allergies, and just general state of lethargy, disinterestedness. If this exposure becomes more intense, then the urine output goes down even further. You have more vomiting, you have more what we call as an intravascular loss in terms of compartment fluid. That means you get internally dehydrated. Your blood vessels shrink. That means they shrivel up, and therefore you can either have hypotension on one side, or you can have a reverse hypertension on the other in chronic ailments. So we have to be extremely careful with regards to duration and direct exposure to this kind of heat.
And is that when you seek medical help, then you hit the danger button when those symptoms become severe?
Yeah, so the fine line, the thin line as a threshold, especially in children, elderlies, and people who are on chronic organ disease on medication, is very narrow. Your window period is very narrow. But anyone who has severe headaches, leg cramps, abdominal cramps, not passing enough urine, vomiting, not retaining adequate amount of fluids, if you have a home blood pressure machine, if your blood pressure recording is down, if you're having general weakness, it's better to consult a doctor. I must add that especially the elderlies and the chronic organ disease and people who are on diuretics, as it is, will run a slightly lower sodium than other normal population. So what really gets hit is your body salts, your what we call as electrolytes. So your sodium goes down, your chloride goes down, and a state of confusion, altered sensorium, less alertness is primarily because of low sodium, what we medically call as hyponatremia. So I think these are red flag signs. Children, irritability, excessive crying, not passing enough urine, not being able to feed well are enough warning signs that they require medical attention.
Okay, so these are warning signs. Then, if you can explain to us what heat stroke means and what are the complications that will happen with a heat stroke?
So, in terms of a heat stroke, which leads on to shock, and the amount of exposure time can be from few minutes to a couple of hours in this kind of intense heat. Is what really happens is that you have a renal compromise. Your kidneys don't have enough fluids. You go into what we call as acute kidney injury. You have muscle cramps. Your muscles start breaking down. You go into what we call as lactic acidosis. That means these are byproducts of protein breakdown, which are released into the blood, which cause the blood to be more acidic. Your electrolyte dysfunction happens, your urea creatinine goes up, your muscle enzymes go up, and you require a very calculated and a very systematic intensive care manner replenishments of sodium, potassium, chlorides, magnesium, body salts, and of course, monitoring if people who are diabetic and hypertensive to monitor their blood pressure, pulse rate, and blood sugar levels.
Okay, let's also talk about precautions right now. How do you cope with the heat? And I want to divide this into do's and don'ts. If you can first of all give us the do's, what should we be doing?
I think we need to, first of all, the state, as far as the Delhi state is concerned. In fact, I've just tweeted early this morning, especially the schools and other offices should be given a few days off. And if necessary, the school's summer break, which is around the corner, can indeed be preponed to avoid children being exposed. In children, especially under the age of 5 or 8 or even up to 10, they have a lot of insensible fluid losses from the skin just by exposure, what we call as convection, loss of fluid. So, modulating the school timing or early school closure, we can have a hybrid model. Don't expose yourself in direct sunlight. Minimum amount of exposure, if possible. Try to stay in a cool environment. Wear clothing which is light and loose, preferably a light colored clothing, because darker clothing attracts and absorbs more sunlight by physics. To take adequate amount of fluids every 1 or 2 hours to replenish your body fluids. To take fluids which have the essential salts, which we call as electrolytes. A simple oral rehydration solution, what we call as ORS, works very well. In adults, it can be similar to a namak or chini, lemonade, or a nimbu pani. Avoid aerated drinks because they are carbonated drinks and that will internally dehydrate you even more. Avoid the use of alcohol because it internally dehydrates you even more. In terms of diet, take normal diet. Don't take anything which is deep fried or very heavy to digest, primarily to keep your system in a normal metabolic state. And watch for urine output. In case you have fever, vomiting, headache, like I mentioned earlier, or muscle cramps, consult your doctor. Do not take unnecessary antibiotics or painkillers. They have no role in this. What you really require is maintenance of body fluids and maintenance of electrolytes. What is also essential is, especially in a country like India, is where we tend to overlook the use of a simple umbrella. Umbrella is not only to protect yourself from rain or monsoons. Umbrella works exceedingly well in summer months. So you should not have any hesitancy in using a sun protection, which is an umbrella. There is also a huge usefulness of wearing a hat or a cap to protect your head and to keep the glares out of your eyes and the face, and to use a sunscreen. I think skin protection is extremely important. Sunburns are extremely important, especially for the elders and the children. And to protect yourself with regards wearing simple linen clothing rather than more heavy clothing would be the need of the hour.
All right, so a couple of things and a quick couple of takeaways from what Dr. Bugai has said. Sunscreen is extremely important. Protect your skin. There are other symptoms that you need to look out for as well. Severe headaches, leg cramps. If your blood pressure is down, you need to watch your urine output. If there's general weakness, all of these things are enough for you to hit the panic button and consult a doctor immediately. Now, a couple of precautions that Dr. Bagai mentioned. One is don't go out in the sun, especially in the afternoon. There should be as minimal sun exposure as possible. Wear light and loose clothing. Have adequate amount of fluids, especially ORS, nimbu pani, etc. Avoid aerated drinks. So these are the couple of do's and don'ts that Dr. Bagai mentioned. Make sure that you follow all of this to ensure that the symptoms don't get to a state where you have to consult a doctor. And if it does, do consult a doctor. Dr. Bagai, thank you so much for joining us and giving us all of that information. Thank you so much for watching.